go ahead and put our path report. And the first thing we need is pull out of consent. So we're gonna go ahead and look for our surgery consent. Take it out. And as you guys can see on the consent, it is gonna ask for a location. This is in the case that some patients might have more than one biopsy and they might need more than one excision. So we wanna make sure we're keeping track of what consent is for what. And to let the patient know that they're agreeing for Dr. Kormeili to perform an excision on that area. So the location for Dr. Marvel is gonna be right lumbar back. So we're gonna go ahead and put right lumbar back dash lateral. You want to make sure that you have this before the patient consents. When they consent, the location should already be there. The patient will go ahead and read it, walks them through the risk and complications, which can be bleeding, infection, scarring, keloid and nerve damage, recurrence of deletion, additional treatment, skin discoloration, texture change, and reactions to medications. We always have to make sure that the patient's aware of these. So I always like to point them out to them so they read it, okay? Then we'll have them do patient name, signature, and date, and we leave this here for the doctor. So we're gonna go ahead and leave that right there. Our path report, and now there's two setups that we need. We need the sterile setup that's gonna go on the Mayo stand, and we need the setup here to begin and to end the surgery. So we're gonna need a tidy towel. Open it all the way up, matte side up, shiny side down. We're gonna get some gauze. You don't need a lot. I need like 2 and then probably like 3. Now we have everything we need here. You're going to need some Hibiclens. You're going to need honey gel. And I'll explain what everything is for once I set it up. You're going to need a 15 blade, and I'm gonna put this one to the side because this is for my sterile setup. I'm going to need, I like working from here down, grabbing everything, make sure I don't miss something. So you're gonna grab some of the tape, scissors, telfa pad. This I'm gonna go ahead and place right here. We're gonna go ahead and need a high handpiece sheet. This is a high fricator sheet. We're gonna put it to the side with the blade. We're gonna need a high fricator tip. Put it to the side. And we're gonna go ahead and need a non-fenestrated drape. Put it to the side. A fenestrated drape. Put it to the side. And we're gonna go ahead and need sterile gloves. You're going to need 3 total, size 6. Okay. To finish this up, we're gonna go ahead and close this. And now we're gonna go down to this drawer. We need a specimen container. The reason why we don't use the small ones is because the excision is gonna be bigger. It will not fit in here. You open it up. You're going to need a marker. I like to leave it open. A ruler. You're also going to need your lidocaine with epi and a 30 gauge. After that, you might need a razor depending on the area of the body. So let's say that it is on the chest and our patient has a lot of chest hair. Dr. Kormeili would shave it before excising. Helps for a cleaner wound. If it's on the back and they end up having back hair, you want to go ahead and shave it before. So this will be depending on your patient. This is going to be the setup that you need for Dr. Kormeili to start the surgery and for you to put the pressure dressing. So I'm going to go ahead and explain what everything is for. So we're going to go ahead and have our Hibiclens. And the gauzes that we have very few of, we're gonna leave dry. The ones that we have about 3 or 4, we're gonna put some hibiclens on it. Dr. Kormeili will go ahead and use this to sterilize the area. And then she will use this to help herself when she's numbing the patient. We always leave the hibiclens out to have some extra in case Dr. Kormeili ends up needing more. Dr. Kormeili will also use the marker to map out the area that she's going to be excising. And we need the ruler to get markings, length of the excision. The lidocaine with epi is the one that Dr. Kormeili is going to need to numb. And we also want to prep it. So we want to go ahead and do this at the time right before surgery. You open up your needle. And you're going to need some sodium bicarbonate. I'm not going to add it in here now, but you would go ahead and add it like up to here, like 2 lines. Go ahead and twist your needle. Get it. Dr. Kormeili will use this to numb the patient. So when you hand it to her, you want to let go of the cap and give it to her this way so that way she can go ahead and grab it and numb the patient. The specimen at the end of the surgery will go in here, and we want to make sure that it's fully closed at the end. This is going to be the area that you will use to put your pressure dressing. So you're going to need some Telfa pad, which is going to prevent the regular gauze from sticking to the sutures. Tape to place over the pressure dressing. Scissors to cut the tape and the Telfa pad if needed. And we need honey gel, which is an antibacterial ointment that we put on the wound at the time right before the pressure dressing. You can cut it.